All right, thanks for coming, everybody. I want to give you an update from the ASDO clinic on our CAD/CAM dentures. So I'm the faculty advisor for the team. We had 2 students that participated, Chris Castellan and Varisha Park. Just want to give you guys an update. They're both 4th-year dental students, and they both got into prosthodontic residencies. So they'll be spending the next 3 years doing dentures. Which is pretty cool, helping them through the interview process and application too, because at most and pretty much all the interviews, this topic came up. They had it on their CVs, you know, they're part of the Spark Tank award, you know, recipient, and then they're starting to do digital dentures. So at a lot of these schools that they went to, they got to talk to the directors about their experience with CAD/CAM dentures. So just thanks to everybody that put this together, it's really paying off. In fact, we had 3 students from the dental department, from dental school, get into a prosthodontic residency, which is the most that we've had in 10 years. So once again, thank you for everything. So just want to spend some time real quickly just to go over how to make a denture, again, make you appreciate sort of what we're doing a little bit more. So I know none of you are going to become dentists, but we'll go through it real quick just to give you a little background. So first thing we want to do is just make a mold of the mouth. We call that a preliminary impression. Then we find out that that mold isn't accurate enough, so we end up making a customized tray to make the next impression even more accurate. So that's sort of what we start, the base of what we're working off of. So if you got an accurate impression of the mouth, then we know our denture will fit pretty well. The next part is to make what we call these occlusal rims, and you can think of these as denture templates. So it's made out of acrylic and wax. The acrylic part sits on the tissue, and then the wax we can adjust very quickly to the dimensions that we need. So we make those, and we go to the patient and we make our different measurements. So some of the things we're looking for are our incisal edge position, which basically just means how much of your teeth do you show when your lips are at rest. There's an average dimension we get to. And then with these rims, we want it obviously parallel to the floor. We don't want things crooked. And then we look at it from the side too, and there's a natural plane that the teeth go as you go more posteriorly. So we want that to be correct. And as people lose teeth, then you have sort of this sunken in look. We want to make sure that there's sufficient lip support. So we go through all these steps to make our denture. Then we put it on a hinge-like device, basically, and it just opens and closes to simulate the mouth. So these are all the analog kind of steps of making this denture. We put denture teeth in there. So based on our template and the dimensions we want, we know where to put our teeth. And we bring the patient back. We'll put it in the patient's mouth, and we'll just see if everything looks appropriate. We'll check that the bite fits correctly, and look at all our aesthetic parameters. And if that looks okay, then we can turn everything that was wax into a hard acrylic, and this is the process method. So essentially, what you do is a procedure called flasking. You boil out the wax, and then you have upper and lower kind of molds of it, and then you fill the space with acrylic. So just some of the parameters we have is it's an injection molding method. It's made out of polymethyl methacrylate. It's pressed at 85 psi. The disadvantage of this is that there's some volumetric shrinkage in the acrylic, so they don't. The idea is with the digital method, we'll kind of eliminate these processing steps. So we have the denture, and we can finally deliver it to the patient. So we'll watch a load of video on the digital method of fabrication. All right, so that's just a little preview. We'll show you all the digital steps and how we combine some of these methods, and then show you some of our cases that we've done in the clinic. So the first thing that you'll notice is that we're going to combine the second and third clinical steps. So what that looks like is we'll make a mold, that already has the rim built onto it. So the impression making step is very similar to the analog method. They still got to make an accurate mold. But instead of sending it to the lab and having these templates made, we put the wax directly onto this final impression. So this is one of our actual patient examples that we did. And what we can do is make our measurements. So we're looking at incisal edge position again, lip support, we're looking at it's parallel to the floor, and all our points are correct. So once our measurements are correct, then we can make a record of how the upper and lower jaw comes together. So with this gets sent to Avident, which is the company in Scottsdale that scans and makes the dentures. So again, incisal edge position, all these things we check for in the digital method. Okay, and this is to get our correct dimension of how far the upper and lower jaw are apart. Okay, so this is what gets scanned in. So they scan our wax mold, okay, and that becomes a template for them to digitally set our teeth. So you can see the line here, that's where we want our incisal edge position. So based on that, they'll know, okay, we can put our central incisor there, and then the rest of the teeth kind of flow from there. They send us this preview back, so we get a digital preview of it. We make sure that the teeth are positioned appropriately in the way we like it. If that looks okay, what they'll do is mill out a what they call a functional try-in. So it's just one piece of acrylic. It doesn't have the pink for it. The purpose of this is to put it in the patient's mouth and confirm that we've nailed all our parameters. So if there's any discrepancy with the bite, or if something's too long or too short, we have the ability to make corrections before the final denture is made. So we take these functional try-ins, we'll place it in the patient's mouth, and then we'll go through our assessment. So this is clinical appointment number 3. And then if everything's okay, what we can do is give the company the tooth color and then the pink shade, and then we could essentially turn that into the final denture, which looks, this is the process of how they do it. So they end up milling out, it's a monolithic, pink and white is all one piece, and they'll mill out a final denture for us. And that's what gets us appointment number 4. So the idea is that we wanted to see how many appointments it would take. So using this method cuts down from 5 appointments down to 4, and then the cost analysis we'll get into in just a second. So we have enough funding to do complete sets of dentures for 9 patients. So we took patients that we had recently done just conventional complete dentures on, and we selected those to be our test subjects. So due to some IRB application mishaps, we got a little bit delayed in our time. So a lot of our 4th year students, by the time we got started, they were 3rd years when we started, they turned into 4th years, which meant that they were on rotation. So a lot of this time frame or time schedule kind of got moved back out. So that's all to say that we have currently 2 of them completely completed out of the 9. We have 5 that are currently in process at one of the various 4 steps, and then 2 are scheduled to be done. So we asked for a 2-month extension, which will give us enough time to finish all 9. So all these results are based on an N of 2, but we will get to all 9 by the end of October. Okay. So cost analysis, we wanted to take a look at what the fabrication costs are. So these are the lab steps. We went back to the patient's charts and then looked at how much it took to fabricate their conventional set. And these are some of the numbers for a particular patient that we picked out for the conventional cost, which is $413. And then we took a look at the digital method, and we found, or we knew that it was going to be much cheaper. So $75 for that try-in, $200 for the final mill denture. This is for 1 arch. Okay, so cost savings of $138. Add on, we end up saving a patient visit. So the average production of a clinic time block in our school is about $100. So cutting down 4 to 5 from 5 down to 4 appointments also has some cost savings. The other thing we want to do is take a survey of the patients. So we give a survey of their conventional set, and we picked kind of 5 parameters, asked them on a Likert scale to kind of rate your current denture, and then have them wear their digital denture, digitally fabricated denture, for 2 weeks, and then complete the same survey. And we want to compare basically conventional versus digital. So based on an N of 2, we have these are the 5 parameters. Retention is just how well the denture sits in the mouth, and does it kind of just fall down. Aesthetics, how well does it look? Mastication is just their ability to chew their food. Speech, and then the convenience of going through the fabrication process. And what we found is the aesthetics of the digital denture just isn't quite there yet. They were able to pick out some subtle differences in the way that the denture teeth are kind of made. So if you look closely, you can see in a conventional set, each tooth here is actually a physical individual tooth. Whereas when they mill the denture, it's one block of white, and then with a fine milling tool, they'll kind of make the lines to make it look like individual teeth. So if you look close enough, you can pick out that the aesthetics aren't quite kind of there yet. Some of the color and the incisal translucency, some people picked out that wasn't as aesthetic. What's interesting is since we've started, we actually have a couple of our faculty members that work for Avident, and they said that they just partnered with one of the denture teeth supply companies and are integrating their technology into making these teeth look a little bit more lifelike and natural. So then we had, as part of the survey 2 evaluation, is faculty evaluates certain parameters of how well they thought that the old versus new denture fit. So one of the things we looked at is vertical dimension, which just signifies the distance from your upper and lower jaw. Occlusion is how the teeth come together, and again, aesthetics, stability is how well the dentures stay in place in a lateral position. Retention is how easy is it to kind of pull it straight down. So a couple things that we found were obviously the aesthetics. If the patient is able to pick it out, obviously the dentist, we pick it out too. But the occlusion, we found that the way that the teeth came together tended to require some adjustments. So it wasn't as spot on as other dentures that we've seen. And again, this is, we've gotten to test the occlusion on about kind of 4 of the patients so far. But with the limited sample size, we kind of had some struggle there. So yeah, we still have a little bit of investigation left. Obviously we have 5 to complete and then 2 to start. But these are some of the preliminary results that we've had since we've started the study. So.